Medical Assistant Exam HIPAA questions. Question 1. After reviewing the situation in a certification exam scenario, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Ignore the error even if it affects care. Option B. Ask a coworker to change it under their login. Option C. Delete the original note completely. Option D. Make an addendum according to office policy. The correct answer is option D. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Clinically important errors should be corrected through proper procedures. Using another person's login violates accountability. Deleting a signed record can destroy the audit trail. Question 2. When a patient encounter unfolds in a same-day appointment, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A. Ignore it because it is not in an exam room. Option B. Place a warning sign and arrange cleanup immediately. Option C. Cover it with loose papers. Option D. Wait until a patient reports slipping. The correct answer is option B. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Safety hazards matter throughout the facility. Loose paper can worsen slipping and does not clean the hazard. Prevention should occur before an injury happens. Question 3. As part of exam preparation in a procedure setup, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A. Notify the provider immediately and follow emergency protocol. Option B. Ask the patient to drive to another clinic. Option C. Tell the patient it is probably anxiety. Option D. Complete all paperwork before telling anyone. The correct answer is option A. Notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Potential cardiac symptoms should be handled through established emergency procedures. Medical assistants should not diagnose the cause of chest pressure. Administrative tasks should not delay reporting possible cardiac symptoms. Question 4. In a clinical skills review, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Soap and water help remove spores more effectively from the hands. Option B. Hand washing is needed only before eating. Option C. Gloves completely replace hand hygiene. Option D. Alcohol sanitizer is always illegal in clinics. The correct answer is option A. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Hand hygiene is required at multiple points in patient care. Gloves reduce exposure but do not replace hand hygiene after removal. Alcohol-based hand rubs are appropriate for many routine situations. Question 5. While working in a clinical skills review, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Finish all remaining patients before telling anyone. Option B. Hide the incident if there is no bleeding. Option C. Wash the area and report the exposure according to protocol. Option D. Place a bandage on the site and ignore it. The correct answer is option C. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. Delaying reporting can delay needed evaluation and follow-up. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Covering the wound alone does not address exposure risk. Question 6. As part of exam preparation in an internal medicine office, a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A. Explanation of benefits. Option B. Sterilization log. Option C. Advance directive. Option D. Progress note. The correct answer is option A. Explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. A sterilization log tracks instrument processing, not claim payment. An advance directive communicates future care wishes, not payment information. A progress note documents clinical care, not insurance payment decisions. Question 7. A medical assistant is working in a specialty referral visit when a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Only the room number. Option B. Procedure code and diagnosis or reason for the service. Option C. Only the patient's favorite color. Option D. Only the assistant's initials with no service information. The correct answer is option B. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Room numbers do not describe the service or diagnosis. Personal preferences do not support claim coding. Initials alone do not provide billing codes or medical necessity. Question 8. While working in an internal medicine office, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A. Wave scheduling. Option B. Stream scheduling. Option C. Prior authorization. Option D. Matrix blocking. The correct answer is option A. Wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Stream scheduling assigns patients specific individual appointment times. Prior authorization is payer approval and is not a scheduling method. Matrix blocking reserves time unavailable for patient appointments. Question 9. An office review in a walk-in clinic shows that the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A. Ventricular repolarization. Option B. Ventricular depolarization. Option C. Kidney filtration. Option D. Atrial depolarization. The correct answer is option D. Atrial depolarization. The P wave represents electrical activation of the atria. Ventricular repolarization is represented by the T wave. Ventricular depolarization is represented mainly by the QRS complex. Kidney filtration is unrelated to electrocardiogram waveforms. Question 10. Before the visit continues in a treatment room, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A. Assume all minors can consent to every service. Option B. Refuse all care without considering exceptions. Option C. Ask another patient in the waiting room to consent. Option D. Follow state law and office policy for consent requirements. The correct answer is option D. Follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Minor consent is not universal for all services. Some laws allow minors to consent for certain services. Other patients cannot provide consent for the minor. Question 11. A medical assistant is working in an electronic health record review when the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A. Painful or difficult urination. Option B. Ear inflammation. Option C. Excessive thirst. Option D. Difficulty swallowing. The correct answer is option A. Painful or difficult urination. Dysuria refers to pain or difficulty with urination. Ear inflammation is otitis. Excessive thirst is polydipsia. Difficulty swallowing is dysphagia. Question 12. When a patient encounter unfolds in an exam room, a rapid strep test requires a throat swab. Which technique is best? Option A. Touch the tongue repeatedly to collect saliva. Option B. Collect sputum from a deep cough. Option C. Swab the tonsillar area and posterior pharynx while avoiding the tongue. Option D. Swab the outside of the lips. The correct answer is option C. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. Saliva and tongue contact can dilute or contaminate the specimen. Sputum is not the specimen used for a rapid strep throat swab. The lips do not provide the specimen needed for strep testing. Question 13. When a patient encounter unfolds in a cardiology practice, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A. Alveolus. Option B. Platelet. Option C. Axon. Option D. Ureter. The correct answer is option C. Axon. An axon carries nerve impulses away from the neuron cell body. An alveolus is a lung air sac. A platelet is a blood component involved in clotting. A ureter carries urine from kidney to bladder. Question 14. To protect safety in a medical office workflow, the provider discusses gas exchange in the lungs. Which structure is primarily responsible? Option A. Villi. Option B. Alveoli. Option C. Tendons. Option D. Ureters. The correct answer is option B. Alveoli. Alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged. Villi increase absorption in the small intestine. Tendons connect muscle to bone. Ureters carry urine from the kidneys to the bladder. Question 15. An office review in a medical office workflow shows that a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A. Skip the pulse and record not available. Option B. Use the patient's previous pulse from the chart. Option C. Count for 10 seconds and multiply by 6. Option D. Count the pulse for a full 60 seconds. The correct answer is option D. Count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. The findings should be measured and reported rather than skipped. Old values do not represent the current clinical status. Short counts are less reliable when the rhythm is irregular. Question 16. To protect safety in a patient intake station, a patient asks for printed medication instructions. Which practice improves health literacy? Option A. Use only complex medical terminology. Option B. Tell the patient to search online without guidance. Option C. Use clear language and review the key points with the patient. Option D. Provide instructions in the wrong language. The correct answer is option C. Use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Complex terms can reduce comprehension. Unguided online searching may provide inaccurate or confusing information. Language mismatch can prevent safe understanding. Question 17. A medical assistant is working in a patient education session when a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A. Promise that the provider will not be concerned. Option B. Acknowledge the concern and explain the procedure in simple terms. Option C. Tell the patient the reading is probably wrong. Option D. Ignore the anxiety to avoid making it worse. The correct answer is option B. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Promising an outcome goes beyond the assistant role and may be inaccurate. Dismissing the result can reduce confidence and may be clinically misleading. Ignoring patient concerns can increase anxiety and weaken communication. Question 18. When a patient encounter unfolds in a same-day appointment, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A. Leave the old pharmacy because it is already in the chart. Option B. Update the preferred pharmacy after verifying the new information. Option C. Choose the pharmacy closest to the clinic. Option D. Delete all pharmacy information from the record. The correct answer is option B. Update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Outdated demographic information can delay medication access. The preferred pharmacy should come from the patient rather than staff convenience. Removing needed information can interrupt prescribing workflows. Question 19. The care team in a busy front office asks for guidance because a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A. Patient confidentiality. Option B. Chain of custody. Option C. Sterile technique. Option D. Prior authorization. The correct answer is option A. Patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Chain of custody concerns specimen handling documentation, not public conversations. Sterile technique concerns preventing contamination during procedures. Prior authorization concerns payer approval for services. Question 20. As part of exam preparation in a phlebotomy station, a patient asks which body system includes the skin. Which system should be identified? Option A. Integumentary system. Option B. Endocrine system. Option C. Urinary system. Option D. Respiratory system. The correct answer is option A. Integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The endocrine system is made of hormone-producing glands. The urinary system filters blood and eliminates urine. The respiratory system supports breathing and gas exchange. Question 21. Before the visit continues in a procedure setup, a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A. Keep the screen facing the waiting room. Option B. Lock the workstation before stepping away. Option C. Disable audit trails to speed workflow. Option D. Share passwords with trusted co-workers. The correct answer is option B. Lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Visible screens increase privacy risk. Audit trails support security monitoring and should not be disabled by staff. Shared passwords weaken accountability and violate security practices. Question 22. At the start of care in a preventive care visit, a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A. Guarantee every claim is paid. Option B. Eliminate the need for training. Option C. Provide standardized guidance for office tasks. Option D. Replace all state laws. The correct answer is option C. Provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Policies do not guarantee pay or reimbursement. Policies support but do not replace staff training. Office policy cannot override applicable law. Question 23. After reviewing the situation in a patient intake station, a subpoena for medical records arrives at the office. Which response is best? Option A. Give it to the provider or designated privacy officer for proper handling. Option B. Immediately fax the entire chart without review. Option C. Ignore it because subpoenas never apply to clinics. Option D. Ask the receptionist to summarize the chart from memory. The correct answer is option A. Give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Records should not be released without verifying legal requirements and scope. Subpoenas can require action and should not be ignored. Summaries from memory are unreliable and not an appropriate legal response. Question 24. During an electronic health record review, a co-worker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A. Quality control testing. Option B. Routine scheduling. Option C. Breach of confidentiality. Option D. Appropriate marketing. The correct answer is option C. Breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Quality control relates to test system accuracy, not social media disclosure. Scheduling does not involve posting private health information publicly. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Question 25. Before the visit continues in a women's health clinic, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A. Eat a heavy meal immediately before every test. Option B. Wear tight clothing that restricts breathing. Option C. Ignore all provider instructions about inhalers. Option D. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. The correct answer is option D. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. A heavy meal may interfere with comfortable breathing for some tests. Restrictive clothing can interfere with respiratory effort. Medication instructions should follow the provider or testing protocol. Question 26. To protect safety in a quality control review, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A. Ureter. Option B. Sinoatrial node. Option C. Gallbladder. Option D. Alveolus. The correct answer is option B. Sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. A ureter carries urine from kidney to bladder. The gallbladder stores bile and is not cardiac conduction tissue. An alveolus is a lung air sac. Question 27. To protect safety in a patient education session, a claim requires the code for an office visit procedure or service. Which code set is used? Option A. CPT. Option B. Zip code. Option C. Policy number. Option D. YCD 10 cm. The correct answer is option A. CPT. CPT codes describe medical procedures and professional services. A zip code identifies location and is not a procedure code. A policy number identifies insurance coverage and does not describe the service. ICD-10-CM codes describe diagnoses and reasons for services. Question 28. While working in a family practice clinic, a voicemail must be left for a patient according to office policy. Which message is safest? Option A, leave limited information and a callback number. Option B, demand payment details with full medical history. Option C, leave another patient's results for comparison. Option D, describe the diagnosis in detail on the message. The correct answer is option A, leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Excessive information violates privacy and may not be necessary. Sharing another patient's information is a privacy breach. Detailed clinical information may be heard by unauthorized people. Question 29. Following office protocol in a telephone triage workflow, a staff member shares an electronic health record password to save time. Which risk is created? Option A, improved privacy protection. Option B, better sterilization monitoring. Option C, automatic insurance approval. Option D, loss of accountability for chart access. The correct answer is option D, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Password sharing weakens privacy and security. Login credentials do not sterilize instruments. Passwords do not control payer authorization. Question 30. Before the visit continues in an infection control audit, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A, deltoid muscle when the medication and volume are appropriate. Option B, the fingernail bed. Option C, a reddened rash site. Option D, inside a visible vein. The correct answer is option A, deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. The fingernail bed is not an intramuscular injection site. Irritated or infected skin should generally be avoided. A vein is used for intravenous access, not intramuscular injection. Question 31. When a patient encounter unfolds in a medical office workflow, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, supine. Option B, Sims. Option C, prone. Option D, Fowler. The correct answer is option A, supine. Supine means lying on the back facing upward. Sims position is side lying with one knee flexed. Prone means lying face down. Fowler position is seated or semi-seated. Question 32. In a treatment room, an intradermal test is being prepared. Which description matches the route? Option A, medication swallowed by mouth. Option B, injection just under the epidermis to form a small wheal. Option C, medication placed into the ear canal. Option D, injection into deep muscle tissue. The correct answer is option B, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Swallowed medication is oral administration. Ear canal administration is otic. Deep muscle injection is intramuscular. Question 33. As part of exam preparation in an infection control audit, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A, opening the wrapper away from the body first. Option B, reaching across the sterile field with an unsterile sleeve. Option C, using sterile forceps for sterile supplies. Option D, keeping sterile items above waist level. The correct answer is option B, reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Opening the far flap first is a common way to avoid reaching over the field. Sterile forceps can help maintain asepsis when used correctly. Sterile items are generally kept in view and above waist level. Question 34. To protect safety in a treatment room, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, only the patient's favorite pharmacy color. Option B, demographics, contact information, insurance information, and reason for visit. Option C, the assistant's diagnosis before the visit. Option D, another patient's insurance card. The correct answer is option B. Demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. That information does not complete registration. The assistant should not diagnose during scheduling. Insurance information must belong to the patient being registered. Question 35. To protect safety in an outpatient laboratory, the provider is running behind and a patient asks for an update. Which response is professional? Option A. Apologize for the delay and provide the best available estimate. Option B. Discuss another patient's emergency as the reason. Option C. Tell the patient that waiting is their only option. Option D. Guarantee an exact time even when it is unknown. The correct answer is option A. Apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. Sharing another patient's situation can violate privacy. Dismissive communication is unprofessional. False certainty can create more frustration. Question 36. During a diagnostic testing area, the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A. Document that the patient requested it and proceed. Option B. Clarify the concern and follow legal scope of practice requirements. Option C. Perform it because any provider request is automatically legal. Option D. Ask another assistant to do it secretly. The correct answer is option B. Clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Patient request does not override scope of practice limits. Delegation does not make a prohibited task legal. Passing on an improper task does not resolve the legal issue. Question 37. An office review in a certification exam scenario shows that the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A. Use the appointment time as the identifier. Option B. Stop and resolve the discrepancy before proceeding with care. Option C. Correct the date of birth without asking anyone. Option D. Continue if the last name matches. The correct answer is option B. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Appointment times are scheduling data and are not approved identifiers. Changing demographic data without verification may create a documentation error. A last name alone does not rule out an identity error. Question 38. The care team in a busy front office asks for guidance because a patient makes a complaint about care received in the office. Which response is most professional? Option A. Argue until the patient stops complaining. Option B. Listen respectfully and follow the office complaint process. Option C. Delete documentation related to the complaint. Option D. Post the complaint online for staff opinions. The correct answer is option B. Listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Arguing escalates conflict and is unprofessional. Destroying or altering records is unethical and may be illegal. Publicly sharing patient concerns can violate confidentiality. Question 39. Following office protocol in a specialty referral visit, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The machine draws blood through the wires. Option B. The test records electrical activity and does not deliver a shock. Option C. The electrodes inject medication. Option D. The test shocks every patient to start the heart. The correct answer is option B. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrocardiogram leads do not collect blood. Electrodes record signals and do not inject medication. A standard electrocardiogram does not deliver electrical therapy. Question 40. The care team in a busy front office asks for guidance because a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A. Post the result publicly so others can comment. Option B. Change the result so it appears normal. Option C. Tell the patient the provider will review and explain the results. Option D. Diagnose the patient based on abnormal values. The correct answer is option C. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Public disclosure violates confidentiality and professionalism. Changing results is unethical and falsifies the record. Diagnosis is outside the medical assistant scope of practice. Question 41. Given the workflow in a quality control review, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A, assault. Option B, beneficence. Option C, abandonment. Option D, coinsurance. The correct answer is option C, abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Beneficence means acting for the patient's good. Coinsurance is a payment-sharing insurance term. Question 42. While working in a telephone triage workflow, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A. Ask respectful questions and avoid judgment. Option B. Refuse to document relevant information. Option C. Tell the patient the practice is foolish. Option D. Assume all people from that culture act the same. The correct answer is option A. Ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Relevant patient information should be documented according to policy. Judgmental language damages trust and may prevent disclosure. Stereotyping ignores individual differences. Question 43. A medical assistant is working in a procedure setup when a tickler file is used in the office. Which purpose does it serve? Option A. Draw blood into tubes. Option B. Track future follow-ups or reminders. Option C. Measure oxygen saturation. Option D. Sterilize instruments. The correct answer is option B. Track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Blood collection uses phlebotomy supplies, not a reminder file. Oxygen saturation requires a pulse oximeter. Sterilization requires approved equipment and process. Question 44. Before the visit continues in an electronic health record review, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A. Print the chart and remove the patient's name only. Option B. Deny the request because there is no job-related need to know. Option C. Open the chart if the coworker promises not to tell anyone. Option D. Share the chart because staff work in the same clinic. The correct answer is option B. Deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. De-identified information must meet specific standards and curiosity is not permitted access. A promise does not create a permitted reason for access. Employment at the same clinic does not automatically authorize chart access. Question 45. At the start of care in a preventive care visit, a patient requests an appointment reminder by text message. Which consideration is important? Option A. Ignore all reminder preferences. Option B. Follow office policy and patient communication preferences. Option C. Text any diagnosis to any phone number in the chart. Option D. Post the reminder on social media. The correct answer is option B. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Preferences help guide appropriate communication. Sensitive information and wrong numbers can create privacy risk. Public posting would expose private information. Question 46. While working in an urgent care office, the term gastroenterology appears in a referral. Which specialty is involved? Option A. Urinary bladder only. Option B. Endocrine glands. Option C. Digestive system. Option D. Nervous system. The correct answer is option C. Digestive system. Gastroenterology focuses on the digestive tract and related disorders. Urology focuses on the urinary tract and male reproductive system. Endocrinology focuses on hormone-producing glands. Neurology focuses on the nervous system. Question 47. Before the visit continues in a medical office workflow, the medical assistant takes a phone message for the provider. Which information is most important to include? Option A. The assistant's guess about the diagnosis. Option B. A promise that medication will be prescribed. Option C. Caller identity, contact information, reason for call, and urgency. Option D. Only the caller's first name. The correct answer is option C. Caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. Diagnosis should not be guessed in a phone message. Medication decisions belong to the provider. A first name alone may not identify the patient or issue. Question 48. After reviewing the situation in a specialty referral visit, blood spills on an exam room floor. Which response follows standard safety practice? Option A. Ask a patient to avoid stepping on it. Option B. Wipe the spill with a dry paper towel only. Option C. Cover the spill with an exam table paper. Option D. Use appropriate personal protective equipment and an approved disinfectant. The correct answer is option D. Use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Patients should not be involved in hazardous cleanup. Dry wiping can spread contamination and does not disinfect the surface. Covering a spill does not remove or disinfect the hazard. Question 49. While working in a pediatric clinic, a patient asks why a medication is placed under the tongue. Which route is being described? Option A. Topical. Option B. Ophthalmic. Option C. Sublingual. Option D. Otic. The correct answer is option C. Sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Topical medications are applied to the skin or surface tissues. Ophthalmic medications are used in the eye. Otic medications are placed in the ear. Question 50. While working in a busy front office, the term cardiology appears in a referral. Which specialty is involved? Option A. Skin disorders. Option B. Heart and cardiovascular system. Option C. Digestive disorders. Option D. Kidney disorders. The correct answer is option B. Heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Dermatology focuses on the skin. Gastroenterology focuses on the digestive system. Nephrology focuses on the kidneys. Question 51. As part of exam preparation in a certification exam scenario, a payer sends money with a remittance advice. What does the remittance advice explain? Option A. How to sterilize forceps. Option B. Which vaccine lot is expired. Option C. Where to place EKG chest leads. Option D. How the claim was processed and paid or denied. The correct answer is option D. How the claim was processed and paid or denied. Remittance advice provides payment, denial, adjustment, and reason information for claims. Sterilization instructions are not part of remittance advice. Vaccine inventory is not the purpose of remittance advice. Electrocardiogram placement is unrelated to insurance remittance. Question 52. Before the visit continues in a patient intake station, the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A. Cover the mouth while speaking. Option B. Assume the patient cannot participate. Option C. Face the patient and speak clearly at a moderate pace. Option D. Shout from another room. The correct answer is option C. Face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Covering the mouth removes visual cues. Hearing difficulty does not mean the patient cannot understand or decide. Shouting from a distance reduces clarity and privacy. Question 53. Before the visit continues in a community health clinic, a patient asks for a copy of their medical record. Which action should the assistant take? Option A. Delete sensitive information before the request is reviewed. Option B. Refuse because records belong only to the provider. Option C. Follow the office release of information process. Option D. Give the record to anyone who asks. The correct answer is option C. Follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Altering the record is inappropriate and may violate legal requirements. Patients have rights to access their health information under applicable rules. Identity and authorization must be verified before disclosure. Question 54. A medical assistant is working in an exam room when a patient has an advance directive in the chart. Which statement is most accurate? Option A. It replaces all insurance forms. Option B. It allows the assistant to ignore provider orders. Option C. It communicates the patient's wishes about future medical care. Option D. It is used only to schedule appointments. The correct answer is option C. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Advance directives do not replace billing or insurance documents. Care decisions still follow legal, clinical, and facility processes. Scheduling is unrelated to the purpose of an advance directive. Question 55. While working in a cardiology practice, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Tell the patient to send an email later. Option B. Schedule the patient for next month. Option C. Follow emergency triage protocol immediately. Option D. Give a diagnosis over the phone. The correct answer is option C. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Potential emergencies require immediate action. Routine scheduling can delay care for potentially serious symptoms. Medical assistants should not diagnose the cause of symptoms. Question 56. For a patient encounter in a treatment room, the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A. Ventricular filling with blood only. Option B. Atrial repolarization only as the visible main event. Option C. A lung gas exchange. Option D. Ventricular depolarization. The correct answer is option D. Ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Mechanical filling is not the primary electrical event represented by QRS. Atrial repolarization is usually hidden within the QRS complex. Gas exchange occurs in the alveoli, not on the QRS waveform. Question 57. For a patient encounter in a family practice clinic, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A. First drops of urine into an unclean container. Option B. Specimen collected from the toilet bowl. Option C. Clean catch midstream specimen. Option D. A random sample from an old urinal. The correct answer is option C. Clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Initial urine can carry contaminants and an unclean container is inappropriate. Toilet water contaminates the specimen. Old specimens may be contaminated and may not reflect current results. Question 58. The care team in a primary care office asks for guidance because an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A. Wait for the provider before starting any response. Option B. Use the defibrillator on a conscious patient asking questions. Option C. Give oral medication before checking responsiveness. Option D. Begin CPR and use the automated external defibrillator as directed. The correct answer is option D. Begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Delaying basic life support can reduce survival. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Oral medication is unsafe when cardiac arrest is suspected. Question 59. When a patient encounter unfolds in a diagnostic testing area, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Ignore the band if the patient seems healthy. Option B. Give medication first and ask about allergies later. Option C. Remove the band so it does not worry the patient. Option D. Verify the allergy information in the record and with the patient. The correct answer is option D. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Allergy risk is not based on appearance. Allergies must be checked before administration. Removing an alert without direction can create risk. Question 60. While working in a women's health clinic, the assistant is comparing two needle gauges. Which statement is accurate? Option A. A smaller gauge number indicates a larger needle diameter. Option B, gauge has no relation to needle size. Option C, a larger gauge number always means a longer needle. Option D, all injections use the same gauge. The correct answer is option A. A smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Gauge specifically describes needle diameter. Gauge describes diameter, not length. Needle gauge varies by medication, route, and patient factors. Question 61. Following office protocol in a telephone triage workflow, a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, record the measurements using the unit required by the office protocol. Option B, use the parent's estimate if the scale is nearby. Option C, record height only because weight changes often. Option D, round weight to the nearest 10 pounds. The correct answer is option A. Record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Estimated weight is less reliable than a measured value. Both height and weight may be needed for clinical assessment. Large rounding errors can create unsafe dose calculations. Question 62. In a phlebotomy station, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A, send it to a number from memory without checking. Option B, include unrelated patient charts in the same fax. Option C, verify the recipient fax number before sending. Option D, leave the fax confirmation on a public counter. The correct answer is option C. Verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Memory errors can lead to misdirected protected information. Only necessary information should be disclosed. Confirmation pages may contain protected information and should be handled securely. Question 63. For a patient encounter in a quality control review, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A, state the full diagnosis loudly to confirm the visit. Option B, ask other patients to help verify the record. Option C, place all charts open on the counter. Option D, speak quietly and avoid announcing sensitive details. The correct answer is option D. Speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Announcing diagnoses in public can violate confidentiality. Other patients should not be involved in private verification. Open charts may expose protected information. Question 64. For a patient encounter in a women's health clinic, a provider orders spirometry in the office. Which patient action is required? Option A, remove the mouthpiece before starting. Option B, follow instructions for a strong, complete breathing maneuver. Option C, hold both nostrils and refuse to exhale. Option D, talk continuously during the maneuver. The correct answer is option B. Follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. The mouthpiece is needed to measure airflow. The test depends on controlled breathing through the device. Talking interferes with airflow measurement. Question 65. An office review in a cardiology practice shows that a patient needs crutch walking education after provider instruction. Which principle is important? Option A, body weight should rest mainly on the armpits. Option B, crutches should be used only on wet floors. Option C, crutches should fit properly and not press into the axilla. Option D, the patient should skip follow-up if pain increases. The correct answer is option C. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Weight should be supported through the hands, not the axilla. Crutches are mobility aids and wet floors increase fall risk. Worsening symptoms should be reported according to instructions. Question 66. As part of exam preparation in a quality control review, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A, remittance address. Option B, referral. Option C, coinsurance. Option D, copayment. The correct answer is option C, coinsurance. Coinsurance is the patient's percentage share of covered costs. A remittance address tells where payments or documents are sent. A referral is permission or direction to see another provider. A co-payment is usually a fixed amount rather than a percentage. Question 67. A medical assistant is working in an infection control audit when the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A, sterile field setup. Option B, order of draw. Option C, coinsurance posting. Option D, matrix blocking. The correct answer is option D, matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Sterile field setup supports clinical procedures, not schedule blocking. Order of draw guides blood collection sequence. Coinsurance posting relates to patient financial responsibility. Question 68. While working in a walk-in clinic, a patient is placed lying face down for a back examination. Which position is being used? Option A, supine. Option B, prone. Option C, lithotomy. Option D, Fowler. The correct answer is option B, prone. Prone means lying on the abdomen with the face downward. Supine means lying on the back. Lithotomy involves legs in stirrups for certain pelvic procedures. Fowler is a seated or semi-seated position. Question 69. Given the workflow in an outpatient laboratory, a patient wants information released to a spouse. Which documentation is usually needed? Option A, no documentation because spouses always have full access. Option B, a valid authorization or permission according to office policy. Option C, a note written by the assistant after the fact. Option D, a verbal request from the spouse only. The correct answer is option B, a valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Relationship alone does not automatically grant full access to records. Authorization should come from the patient or legal authority. The spouse's request alone may not authorize release. Question 70. A medical assistant is working in a pediatric clinic when the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A, below normal. Option B, around. Option C, above normal or excessive. Option D, between. The correct answer is option C, above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Below normal is indicated by hypo. Around is indicated by peri. Between is indicated by inter. Question 71. In a walk-in clinic, a claim requires the code that explains why a service was performed. Which code set is used? Option A, NDC only. Option B, ICD-10-CM. Option C, place of service only. Option D, CPT. The correct answer is option B, ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. National drug codes identify medications and do not describe diagnoses. Place of service identifies setting, not the medical reason for care. CPT codes report procedures and services rather than diagnoses. Question 72. For a patient encounter in a cardiology practice, a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A, apply electrodes directly over lotion. Option B, clean and dry the skin before applying electrodes. Option C, use tape only and skip electrodes. Option D, move all chest leads to the abdomen. The correct answer is option B, clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Poor adhesion can cause artifact or lead loss. Tape cannot record cardiac electrical activity. Incorrect lead placement changes the tracing and may impair interpretation. Question 73. When a patient encounter unfolds in a specialty referral visit, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, coordination of benefits. Option B, emancipation. Option C, battery. Option D, defamation. The correct answer is option C, battery. Battery can involve intentional touching or treatment without consent. Coordination of benefits is an insurance concept. Emancipation relates to a minor's legal independence. Defamation involves false statements that harm reputation. Question 74. Given the workflow in a procedure setup, an electronic record uses an audit trail. What is its purpose? Option A, sterilize instruments automatically. Option B, approve insurance claims instantly. Option C, measure blood pressure. Option D, track who accessed or changed information. The correct answer is option D, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Audit trails do not process instruments. Payer claims processing is separate from record audit logs. Vital sign measurement requires clinical equipment and technique. Question 75. Following office protocol in an infection control audit, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A, beneficence. Option B, respondeat superior. Option C, patient autonomy. Option D, abandonment. The correct answer is option C, patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Beneficence means acting for the patient's good but does not override a competent refusal. Respondeat superior concerns employer responsibility for employee actions. Abandonment involves ending care without proper notice or support. Question 76. The care team in a women's health clinic asks for guidance because the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A, below normal or deficient. Option B, before. Option C, above normal. Option D, against. The correct answer is option A, below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Before is indicated by pre. Above normal is indicated by hyper. Against is indicated by anti. Question 77. The care team in an electronic health record review asks for guidance because the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A, no documentation is needed for symptoms. Option B, patient is definitely exaggerating the cough. Option C, the assistant diagnoses pneumonia. Option D, patient states, I have had a cough for 3 days. The correct answer is option D, patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Symptoms are relevant to the visit and should be documented according to policy. Judgmental wording is inappropriate and not objective. Diagnosis belongs to the provider. Question 78. As part of exam preparation in a primary care office, an insurance plan requires approval before a specialist visit. Which process is being described? Option A, autoclaving. Option B, prior authorization or referral process. Option C, venipuncture. Option D, auscultation. The correct answer is option B, prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Autoclaving sterilizes instruments and is unrelated to payer approval. Venipuncture is blood collection and does not authorize insurance coverage. Auscultation is listening to body sounds and does not approve visits. Question 79. After reviewing the situation in an infection control audit, the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A, tourniquet. Option B, hemostat. Option C, Snellen chart. Option D, autoclave tape. The correct answer is option C, Snellen chart. A Snellen chart is used to screen distance visual acuity. A tourniquet helps locate veins for blood collection. A hemostat clamps tissue or small objects during procedures. Autoclave tape indicates exposure to sterilization conditions. Question 80. While working in a family practice clinic, a pain score is being collected during intake. Which approach is best? Option A, ask the patient to rate pain using the office's standard scale. Option B, change the score to match the assistant's opinion. Option C, tell the patient pain is not part of vital signs. Option D, assume pain level from facial expression only. The correct answer is option A, ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. The pain score should reflect the patient's report. Pain assessment is commonly included in intake workflows. Facial expression alone may not reflect the patient's reported pain. Question 81. The care team in an outpatient laboratory asks for guidance because the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A, 10 mm per millivolt. Option B, 25 mm per millivolt. Option C, 100 mm per millivolt. Option D, 1 mm per millivolt. The correct answer is option A, 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That value is not the common standard amplitude calibration. That value would greatly exaggerate waveform size. That calibration would make complexes appear too small for standard interpretation. Question 82. Given the workflow in a same-day appointment, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, keep only the first void and discard the rest. Option B, collect urine only when symptoms occur. Option C, discard the first void and collect all urine for the next 24 hours. Option D, leave the container unrefrigerated unless it smells unusual. The correct answer is option C, discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. A single first void is not a 24-hour collection. Timed urine testing requires all urine during the collection period. Storage requirements should follow the test protocol and preservative instructions. Question 83. During a pediatric clinic, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A, deductible. Option B, premium. Option C, copayment. Option D, adjustment. The correct answer is option C, copayment. A copayment is a fixed amount the patient pays for a covered service. A deductible is the amount the patient pays before insurance begins paying according to the plan. A premium is the amount paid to maintain insurance coverage. An adjustment changes the billed amount based on contracts or corrections. Question 84. As part of exam preparation in an urgent care office, a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A, use the oldest card in the file without asking. Option B, verify insurance eligibility at each visit according to policy. Option C, code every visit as preventive care. Option D, skip registration for returning patients forever. The correct answer is option B, verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Old cards may no longer reflect active coverage. Coding must reflect the service and documentation. Returning patients can have changed insurance or contact information. Question 85. During an electronic health record review, office supplies are consistently running out before the next order date. Which administrative action is best? Option A, order random supplies without reviewing use. Option B, hide supplies from the provider. Option C, track usage and adjust par levels according to office needs. Option D, wait until every item is completely gone. The correct answer is option C, track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Unplanned ordering can waste money and storage space. Hiding supplies does not solve inventory management. Waiting can interrupt patient care and office workflow. Question 86. A medical assistant is working in a clinical skills review when the provider discusses the function of white blood cells. Which role is most accurate? Option A, produce insulin in the pancreas. Option B, store bile for digestion. Option C, carry oxygen as their primary job. Option D, help defend against infection. The correct answer is option D, help defend against infection. White blood cells are immune cells that help protect the body from infection. Insulin production occurs in pancreatic beta cells, not white blood cells. Bile storage is a gallbladder function. Oxygen transport is mainly the role of red blood cells. Question 87. Following office protocol in a busy front office, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A, place the dressing on the clean supply tray. Option B, handle the dressing with bare hands. Option C, use gloves and dispose of the dressing according to biohazard policy. Option D, save the dressing in the patient's purse. The correct answer is option C, use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Soiled material can contaminate clean supplies. Bare hand contact increases exposure risk. Biohazard waste should not be sent home in personal belongings. Question 88. After reviewing the situation in a community health clinic, a prothrombin time test is ordered. Which tube should be selected? Option A, blood culture bottle only. Option B, light blue tube. Option C, lavender tube. Option D, gray tube. The correct answer is option B, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Blood cultures detect microorganisms and are not used for prothrombin time testing. Lavender EDTA is used for hematology and can interfere with coagulation testing. Gray fluoride oxalate is not the standard additive for coagulation studies. Question 89. During a specialty referral visit, a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A, keep the surface wet for the full listed contact time. Option B, dilute the solution more to reduce odor. Option C, use the disinfectant only on clean hands. Option D, wipe the surface dry immediately. The correct answer is option A, keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Unapproved dilution can reduce disinfectant strength. Environmental disinfectants are not hand hygiene products. Removing the disinfectant too soon can make it ineffective. Question 90. An office review in a procedure setup shows that the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A, open hours. Option B, clustering. Option C, double booking. Option D, wave scheduling. The correct answer is option C, double booking. Double booking places more than one patient in the same appointment slot. Open hours allow patients to arrive without exact appointment times. Clustering groups similar types of appointments together. Wave scheduling schedules several patients to arrive at the beginning of a block. Question 91. While working in a walk-in clinic, a patient falls in the exam room. Which action is best? Option A, hide the incident if no one saw it. Option B, call for help and assess for injury before moving the patient. Option C, tell the patient to drive home without evaluation. Option D, pull the patient up immediately. The correct answer is option B, call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. Falls must be reported and documented according to policy. The patient should be assessed before leaving. Moving the patient before assessment can worsen an injury. Question 92. Before the visit continues in an electronic health record review, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A, remove the tourniquet and continue filling all tubes. Option B, gently adjust the needle position while maintaining safety. Option C, probe aggressively until blood returns. Option D, label the empty tube as collected. The correct answer is option B, gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. Without blood flow, the collection cannot continue effectively. Excessive probing can injure tissue and increase patient discomfort. A tube without the required specimen must not be labeled as completed. Question 93. In a pediatric clinic, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A, recommend doubling the dose instead. Option B, refer the question to the provider. Option C, tell the patient to stop immediately. Option D, suggest using a friend's medication. The correct answer is option B, refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Changing a dose without provider order is unsafe and outside scope. Directing medication discontinuation is outside the assistant role. Sharing medication is unsafe and inappropriate. Question 94. Following office protocol in a pediatric clinic, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A, report and correct the filing error according to policy. Option B, ask the patient to sign a blank form. Option C, delete the form and tell no one. Option D, leave it because both patients use the same clinic. The correct answer is option A. Report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Blank forms do not correct the misfiled record and are inappropriate. Unreported deletion can worsen the documentation error. Clinic use does not make one patient's document appropriate in another chart. Question 95. Before the visit continues in a medical office workflow, the provider mentions the largest artery in the body. Which vessel is being described? Option A, pulmonary vein. Option B, carotid vein. Option C, aorta. Option D, vena cava. The correct answer is option C, aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. Pulmonary veins return blood from the lungs to the heart. Carotid structures are in the neck, but the carotid artery is not the largest artery. The vena cava is a large vein returning blood to the heart. Question 96. Before the visit continues in a specialty referral visit, the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A, air in the lungs. Option B, sugar in the blood. Option C, blood in the urine. Option D, protein in the stool. The correct answer is option C, blood in the urine. Hematuria means blood is present in the urine. Air in the lungs is not described by hematuria. Sugar in the blood is described by glycemia terms. Protein in stool is not hematuria. Question 97. When a patient encounter unfolds in a certification exam scenario, a patient signs permission after the provider explains a procedure's risks, benefits, and alternatives. Which concept is demonstrated? Option A, implied consent. Option B, informed consent. Option C, battery. Option D, abandonment. The correct answer is option B, informed consent. Informed consent occurs when a patient agrees after receiving enough information to make a voluntary decision. Implied consent is inferred from actions such as extending an arm for a blood draw. Battery involves unauthorized touching or treatment. Abandonment involves ending care without appropriate notice. Question 98. Given the workflow in an urgent care office, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, notify the provider or designated clinical staff promptly. Option B, discard the result because it is abnormal. Option C, file the result for review at the end of the month. Option D, tell the patient the exact diagnosis without provider review. The correct answer is option A, notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Abnormal results must be reported, not discarded. Delaying a critical result can put the patient at risk. Diagnosis and interpretation belong to the provider. Question 99. While working in a clinical skills review, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A, leave the patient alone until they stop coughing. Option B, encourage coughing and monitor closely. Option C, give the patient food to push it down. Option D, perform blind finger sweeps immediately. The correct answer is option B, encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. The patient should be monitored because the obstruction may worsen. Food can worsen the obstruction. Blind finger sweeps can push the object deeper and are not appropriate. Question 100. The care team in a same-day appointment asks for guidance because the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A, ear infection diagnosed today. Option B, patient reports sharp right ear pain for 2 days. Option C, patient seems dramatic about ear pain. Option D, right ear normal after exam. The correct answer is option B, patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. A diagnosis should not be documented by the assistant unless the provider has made it. Subjective judgment is unprofessional and not appropriate for the medical record. Exam findings belong to the provider and are not the chief complaint.